Ladies and gentlemen, welcome to 4 Minutes with your host, Ethan Miller.
Hi, I'm Ethan Miller, and today I'm going to be telling you about melanoma. Melanoma is a cancer that starts in a certain type of skin cell. Now, there are some risks to getting melanoma, such as having red and blonde hair, or green and blue eyes, or greater than having 50 moles on your body, or if there's blood relation in your family that has melanoma. Now, you may not believe me, there were 123,000 new cases of melanoma in 2011. People with the most risk of getting melanoma are Caucasians and men over 50. Now, females, you're not quite out of it. Females from 15 to 29 years old have a high risk of getting it too. Every hour, there is a new person diagnosed with melanoma. It can be treated by surgery in late stages of chemotherapy. It's the most deadly form of cancer. But enough with me talking. Let's go talk with dermatologist Dr. Jonathan Wolf after these messages. Thank you for having me here, Dr. Wolf.
Oh, thank you for coming to my house, spending the time with me.
Can you just explain to me what is melanoma?
Melanoma is a skin cancer which stems from the pigment cells of the skin, the cells that give color.
What are some warning signs to melanoma?
Warning signs for melanoma are when a mole changes in any way. The color, the border of it, the size of it, the itching or bleeding of it. Those are the main symptoms of melanoma.
Now, who's more at risk? Men, women, old, young children?
It's pretty equal across the different sexes. In other words, the numbers of melanomas are pretty equal across the board between males and females. Certainly older people tend to have more melanoma than younger people, but when you really break down statistics of melanoma, there are certain age groups in young people, such as females in their 20s, who do get melanoma. So there's no one specific answer to that question. It's a very complex question, but in summary, it tends to occur in older people, equal among the sexes.
How is this cancer detected?
It's detected by observation exams by doctors who look at people's moles and educating people themselves to look at their own moles looking for changes.
How is this cancer treated?
It's treated by surgically removing the mole and then depending on the characteristics of the melanoma, if the mole is indeed a cancer, going for additional surgery or chemotherapy or both.
I see. Now, last question. What is the survival rate?
Survival rate is totally dependent on how deep the melanoma is in the skin. The deeper it is, the worse the survival. So the goal is always to get it very, very thin, very, very early, and then the survivability is excellent.
Okay, well, thank you for having me here.
Thank you.
Thank you for watching, and have a fantabulous day, people.